this video, we're going to talk about some mobilization techniques for the first rib. So one of the techniques I like to use a lot is in the seated position. You're going to place one leg up on the table and have the patient place the arm on the contralateral side on your leg. You then place your second MCP on the first rib on the side you're treating, and you're going to be providing a force going inferior and slightly medially. And simultaneously, you're going to provide that force and add a little bit of a whole body shift to the right, and I'm side bending his head to the left. The reasoning behind the arm being up here is that we're trying to untension the upper trap on each side here, so that as you side bend towards the treatment side, the upper trap isn't what limits you. And this technique usually feels pretty good for the patient. You can also perform a thrust in that same spot, just same exact direction, just at a slightly inferior and medially directed force. Go ahead and lay on your back. Now in some cases you want to perform some treatment in the supine position here for the first rib. So I'll simply take that same second MCP and find that first rib, and again it's inferior and slightly medially with a little bit of ipsilateral side bend on the head. You can either just mobilize it or perform a manipulation. Now going to the prone position, this is where we're going to treat the second rib. So here, you find the second rib, it's typically around where the levator scapula inserts into the superior angle of the scapula. But what you can do is find T2 and walk your finger over until you get onto the rib surface. Should be pretty lateral, but still palpable before you get to the scapula. Now I'll do a couple of techniques here. If the patient is super sensitive, I'll just use my pisiform or hypothenar eminence from the contralateral side and provide a P to A force slightly medially and laterally. Now if the patient can tolerate more, or if the rib is still really stiff, sometimes what I'll do is I'll place my thumb right over where the rib is to add a little bit more focalization of the force, and then I'll use my ipsilateral side to provide that same exact force from posterior to anterior and slightly medial to laterally. And if you happen to notice that any of the other ribs are a little bit stiff in this area as well, you can kind of work your way down as needed. These are a few of the techniques that I like to use for improving rib mobility.